So the most skilled part of what we do as physical therapists and kind of our niche in helping people get better is in diagnostics. And the reason this is super important is because there's this really sticky thing called referred pain. And what referred pain is where the pain actually is being felt is not always where it's coming from. So we're going to dive deeper into this, and we're going to talk a little bit more about referred pain and some of the most common referred pain spots that we see in the body. Some of the most common things that people try to do to treat their issues is they try to take a lacrosse ball like this, and then they'll try to massage or mash the tissue. Another common thing that people will do is they'll take a massage gun and they'll kind of beat the area up with some sort of vibration therapy, and they're trying to get that pain release and get the pain to go away. But again, if it's a referred pain problem, you're just wasting your time. So let's fast forward into some of these pain problems. The best way to make my point and explain kind of the complexities of this is I drew this really awesome chart. So on this side here is where the pain hurts or where the pain is felt. And on this side here is the potential causes or where that pain could be coming from. Now, if you don't identify the cause, the pain won't get better. So this is where we step in and we make sure that you get the right care that you need. So first spot, shoulder blade pain. A lot of times patients will complain of pain back here. It'll kind of radiate up. Sometimes it'll just linger back there. One of the sticky things about shoulder blade pain is a lot of people will take that lacrosse ball and mash it. But the problem is that pain could be coming from your neck. It could be coming from a rib that's dysfunctional, or it could be coming from a strained rhomboid. Believe it or not, this is the least common of these, the strained rhomboid. Most of the time, I'd say 9 times out of 10, it's coming from the neck or a rib. The next most common area that we see clinically is the shoulder. So patients will complain of pain that radiates either down the side, it's in the front of the shoulder, or sometimes it'll go down the bicep. Very rarely does the pain go down the back of the shoulder, but for the most part, the shoulder pain will be here and here. When you look at the potential causes, the rotator cuff can refer pain there. Your neck can refer pain to both of these spots. The labrum within the shoulder, and then also trigger points. What trigger points are little knots within muscle, and if a trigger point is active, then it can refer pain to a different location. So there's a number of these trigger points in the upper trap, some of the rotator cuff muscles, the neck, that can all refer pain into that same presentation. So until you know where it's coming from, it's a little bit elusive. The next is the tricep. So people are having pain down and through this area. Again, it can be coming from your rotator cuff, it could be coming from your neck, it could be coming from the tricep itself if you have a tricep tendon issue, and then also, again, those pesky trigger points can go and refer pain to that same spot. And then lastly, but not least, the elbow. So people will complain of elbow pain either on the outside of the elbow, inside of the elbow, or kind of in this area in between. That pain can radiate down into the hand, different fingers, cause numbness, tingling. It can just be dull and achy. Any of those symptoms qualify for this. Potential causes there are, again, that rotator cuff, the neck, so a pinched nerve can refer to all those different areas. Forearm muscles, so some of the different tendons that cause golfer's elbow, tennis elbow, and then also trigger points that are higher up can refer down there. And most of those trigger points are in some of the muscles back here as opposed to the muscles up here. So again, you can see why this is so tricky and difficult to treat, because a lot of times people want to simplify healthcare. They want to simplify injuries and say, oh, it hurts here, so I just need to mash this, or I need to stretch this. But the cause of the problem can be somewhere else. So you're just wasting time, you're wasting energy, and you're wasting dollars. So go find a provider like us that can help diagnose the issue and then solve the problem for you once and for all. So in terms of referred pain, pain will always travel from an area higher up to an area down lower. So for example, if you're experiencing pain in your shoulder, it's not going to be coming from your forearm. It's usually going to be coming from either the shoulder itself or higher up. Now, things get a little bit trickier the further away you get. So if you're having pain down in your arm or into your hand, numbness, tingling, any symptoms like that, then it's most likely coming from somewhere higher up. Well, there's a lot more structures on the way up there. So diagnostics become even more important the further away from the center or the midline of your body is. Active adults and athletes get these types of referred pains all the time. So that's why it's super important that we figure out where it's coming from.